and all of that. What does that all that mean? And I've been joined by Dr. Hilda Boy, who is a pediatrician and also a JH Health Connect. She's the, I think she's in charge of that, and she's going to help us to understand what you should know in terms of pediatric health and COVID-19. Good morning, Hilda.
Good morning.
How are you?
I'm fine, and you?
I'm very well, thank you.
Awesome.
All right, thank you for joining us this morning. Now, let's talk about things let's start with the parents' side of things. What are the things that parents should know as far as their children's health is concerned, practices? We're focusing on COVID-19.
Yes.
So practices that they should stop doing, practices they should engage in now. How can they make the whole experience a little less tedious for their kids?
All right.
Yeah.
Thank you. So I'd like to start by saying that this pandemic is new to many of us who happen to be alive at this time. We have not experienced anything like this before ourselves. That's for many people. And so the same anxiety that parents feel is the same anxiety that our children also experience. Yes. So you are not alone. I'm not alone. Even as a doctor, as a pediatrician, I also have some concerns. Sometimes you're uneasy about what is going on. But the good thing is that we can support each other through this journey. We can help each other come out stronger of this pandemic. So important thing, parents should calm down. They should help to calm their children down so that together relaxed, we are better ready to face this pandemic. Now, so you keep on reassuring yourself, keep on reassuring your children that this will be over someday. We'll be back to our normal lives someday. So let's calm ourselves down. However, we should not lose sight of the fact that COVID-19 is still with us and it kills. Initially we were, keep calm, stay calm, don't be too anxious, don't be too worried, and people let their guards down. The protocols have been thrown away in many cases. People are not following the protocols. As a parent, it's important for you to do the right thing so that your child finds it easy to imitate you or emulate you. What we do is what our children do.
Copy.
Yes, exactly. So if you tell your child, put on your mask, and you are not child sees you at a party or somewhere that you are not even supposed to be in the first place, or you could have avoided going in the first place without your mask on, then what you are telling the child is that it's okay to take your mask off. It's okay to get COVID-19. It's not a problem at all. But that is not the information that we want out there. Yes, it is COVID-19. You can help to prevent yourself from getting it and prevent your loved ones from getting it by observing the protocols. So parents, observe the protocols and teach your child to observe the protocols as well. So do as I do, not do as I say. So let's try as parents to be a good example to our children. Now, regarding mask wearing for children, we know that WHO recommends that for children less than 6 years should not wear the mask or are not required to wear the mask. Children 6 years and above can safely wear the mask. However, if there's a child who has a disability, you should make sure that when this child has a mask on, there's strict observation or there's somebody around to assist the child in case the child has any problem with the mask that he or she has on. Again, even for the older children, like children above 6 years, we know how they can play and how they can tamper with things. And some of them may also not be alert enough. So you let them know that if at any point in time, whilst they have their mask on, they have any difficulty breathing or they feel any form of discomfort, they should let the adult near them know. So the teacher, in the case of the schools, for example, can be told. The teacher will then send the child out somewhere or distance the child from the other children, and the child can take off the mask, breathe in, breathe out till the child is comfortable again, and the mask can be put back on. So with the protocols, we know them, and thankfully, even though we know there's a new variant, the same protocols, COVID-19 preventive protocols, are still valid and work. Now, regarding the schools, we mentioned some time ago that they should label the mask, even in the classroom, so that it is like reduces the chances that other children are going to wear the same mask, so reduce exchanges. So you label the mask. Now, there have been some security concerns raised because people say, okay, so this child is boarding a trotro from, let's say, Hacho to Medina, and the name is boldly written on it, and a stranger can see, call the child, harm the child. So we can do initials. So you can do initials with embroidery, or depending on what kind of mask it is. So if it's a surgical face mask like what we are wearing, there are smaller sizes for children. The initials can be put on with a marker, just enough so that other children know that, no, this is not mine. The teacher also knows that this is for this child. So in case there's any confusion, the labeling helps to prevent or reduce the exchanges. Again, if it is a cloth face mask, you know that you can do embroidery. Embroidery will last longer. So embroidery, or you just use a needle and a thread to sew the name, the initials onto the mask, and you are good to go. You give your child more than one mask. So your child should have more than one mask. There should be about 2. So if the child is going to school, has one on, by the time, assuming the mask falls or gets dirty, teacher has the room to say, okay, pick the other clean mask that the child can use, and then that is very helpful. Another thing, you give your child a container or a Ziploc bag or a big envelope, brown envelope or so, that the child can safely put the mask in between breaks. So if they're having lunch, for example, the child can put that mask inside, and meanwhile you have another spare mask already, which is also safely put in a Ziploc bag or any clean container that it can be put in for the child. So these are all things that are helpful. And also sanitizer poisoning. So you tell your children that this sanitizer that I'm giving you for school, it's not for you to eat. Yes, so don't put it in your mouth. And also, we should not put these sanitizers in containers that our children can easily drink or take. If you are giving them the sanitizer don't give them too much at a time. Just give them a small quantity, just enough for a day. So in case something happens accidentally, the child consumes it, it will not be a big amount that the child has consumed. It will be a very small amount. Again, if the child happens to have taken any of this, don't give the child palm oil. Send the child to hospital with a container of whatever the child has taken, so that we can take over from there. So these are a few of the basics. Now somebody will ask, should I give my child antibiotics before school reopens or before child goes to school to help so that child doesn't get COVID-19? No, we are not recommending that. So we know also that children get colds and coughs often. And it's difficult to tell whether this cold or cough or sore throat that the child has got is as a result of COVID-19 or not. So there also, we've said many times that if your child is sick, keep the child at home, send the child to a healthcare facility so that the child can be taken care of. Don't send sick children to school. You never know what they have, and you may end up going to spread the disease to other children who will then take it home to their lovely grandparents and cause problems for them.
Very unfortunate. Okay, so those of you who are watching, the hashtag is Breakfast Daily. If you have any questions, any concerns for Dr. Hilda Boy, we'll send them through so that we can ask her. The WhatsApp line is 0550-585832. If you happen to be outside Ghana, please use +233 as the country code. Now, there's something you mentioned earlier when you were talking about masks, and that sometimes you may have to take off the mask and let them, breathe in and out, and then put it back on again. Now, here's the question that I've had since the beginning of this whole COVID thing and the wearing of masks. You find that surgeons, would typically wear one of these. It could be, 7 hours, 12 hours, 15 hours doing surgery. When you hear people saying, oh, I can't breathe when I wear the mask, is it possible that they actually can't breathe? Or it's just the frustration of the new experience of having this thing in your face. What's really going on there?
So it's a mix of both. So both the fact that it's new something, there's something in your face that you are not very comfortable with, you are not used to. So that bit is there. There are also some, maybe it's been on for a long time, you start feeling uncomfortable or you suddenly feel like you're not getting enough air because you see, without it, there's free flow of air.
Yeah.
With it, there's a sort of obstruction, or blockage. So it is real. And it's important that if at any point you feel uncomfortable, you distance yourself, you take it off as you're supposed to and put it back on. Also, if the child, for example, has a condition, let's say, so there are some who may have conditions, maybe a congenital heart disease or something that may already compromise their breathing. In those children, when they have the mask on, you need to be very observant and you need to let them know that if at any point they feel uncomfortable, they should distance themselves, take it off or alert a healthcare provider. We've already spoken for the children who have one form of disability or the other. So I was just speaking with Dr. Mabel, Mission Pediatrics, and what she was saying was that, so her clinic now, she's had to make a lot of changes. And you know how she deals with children with disabilities and she has to play with them a lot in the assessment, and also as it is now, she's had to modify a lot of things because, you know, these children will not put their mask on or keep them on, and they are always playing with it. So we've all had to adapt, both in the clinic setup and as we go out on our daily activities. So there's a lot of adaptation going on. And if we lose our guards or we let down our guards, we may be taken away by this disease, unfortunately.
Okay, so we would definitely have to have you back and talk about other aspects of this, but just to wrap up for us, the issue of acidosis. You know, people feel that, okay, listen, if I'm wearing the mask, I'm breathing in the same air, which means as I breathe out carbon dioxide, I'm only breathing carbon dioxide back in. I'm going to be poisoning myself. Is that a real concern?
So the thing, or the good news for many, is that you see, with this surgical mask or even the cloth face mask, hardly do they fit so tightly. You see, so there's still a little room for air to be escaping. So some air comes in, comes out. It's just that it helps to block and reduce the number of droplets that you are sending out, which otherwise
would have splashed everywhere.
So that is the thing, or the good thing about the mask. So don't be too worried about it, you see. And with some of these things, we say, oh, people are looking for reasons why they should not have the mask on. But even using Ghana as an example, we know that the mask work. You look at the time when we started wearing our mask, look at the numbers that we had. And then when we went into the Christmas festivities, the elections and all, and people had them more big programs without masks. Now you see the numbers. So you should not be surprised, and it should tell us all that the protocols work. And we know now that even if you have the mask on, that alone is not 100% protective. So you should also observe the other protocols, the physical distancing, the hand washing with soap and water and all, to help to protect you and your loved ones.
Just really quickly, we have like 10 seconds. Quick question from Oscar. Oscar is saying, please ask the doctor, how often should I wash my nose mask? I'm assuming it's the cloth one.
If it is the cloth face mask, after use, you wash it, you dry it, iron it, and it's good for use again. That's why you need more than one. So that at any point in time, you have a fresh one to use.
All right. Super. Thank you very much. We will definitely continue this conversation and other conversations around this whole COVID thing and children and all that. So we've been speaking with Dr. Hilda Boy, who is a medical practitioner, a pediatrician with the Kolibu Teaching Hospital, and also she's a CEO of JH Health Connect. We'll be right back, and let's take a look at our entertainment highlights.
Hello, welcome to Entertainment Highlights on Breakfast Daily. My name is Kwame Dazi. Ghanaian artist Joey B has a word for the general public. He's advising individuals who have tested positive for COVID-19 not to keep their status as a secret and be mingling with people. According to him, it is not a crime for anyone to test positive for the disease, so it is prudent they disclose their status and not to go join friends to party at social gatherings. On his Twitter handle, he wrote, "Dons, if you get COVID, it no be crime o. If you make your people know, don't test positive and come jam plus we." What that? Shaking my head. Joey B's advice comes on the back of reports on the current rise in the numbers of COVID-19 cases in Ghana. When he put up the post, some of his followers took turns to share their experiences with the disease, saying it is real and must be taken seriously. Rapper Sarkodie is the next person to earn nomination in this year's MTV Africa Music Awards. He was nominated in the Listener's Choice Awards category. Sarkodie will be competing with about 19 artists from 18 different African countries. Some of the nominees are Anna Joyce from Angola, Dagidi, Ethiopia, DDB, Cote d'Ivoire, Drizzy Lake, Sierra Leone, Focalistic, South Africa, Calligraph Jones, Kenya, Loco, Cameroon, Mehdi, Rwanda, and Mohamed Ramadan, Egypt. This year's MTV Africa Music Awards will be hosted virtually on February 20, 2021. Uganda, Pearl of Africa, has been announced as a partner of the prestigious award scheme, which showcases the ultimate in African culture, music, and creativity. Apart from Sarkodie, Ghana's Shatta Wale has also been nominated for the fan base category. To vote for Sarkodie and Shatta Wale, visit www.mtvmama.com. Kanye West and Kim Kardashian have been rumored to be going through marriage problems for a while, but now it seems the pair might address it on Keeping Up with the Kardashians. Page 6 reports that Kim and Kanye have already filmed portions of the show for the final episodes of Keeping Up with the Kardashians, and they get into the details regarding their allegedly turbulent relationship. The Kardashians intend to go out with a bang. The source said of the final run of episodes of the reality show, which is set to end this year after 20 seasons. They filmed Kim discussing her marriage problems, but everybody involved is on a non-disclosure agreement because the finale won't screen until later in 2021. Earlier this month, it was reported that a divorce was imminent, with earlier sources claiming they had been living separate lives for a good portion of 2020. US Magazine reports that Kanye isn't happy about the final season of Keeping Up with the Kardashians, with one insider claiming he's less than thrilled the topic of their marriage issue is broached on the show. It is unclear if the couple has split already, but it is worth noting that Kim's annual Christmas photo last month did not feature Ye. It is rumored the pair went into counseling sometime recently, but sources later suggested they had given up on salvaging their marriage. And that's all for entertainment highlights on Breakfast Daily. My name is Kwame Dazi.